thanking everybody and congratulations to this center, which is so important. A huge achievement for our faculty and the University of Oslo. And also thank you, Eivind, for some very interesting discussions with you and Christian Heggen about this topic, with which I'm very much involved, in fact, for many years. My name is Knut Lundin. I'm at the Institute of Clinical Medicine, head of the clinical education. I'm an internist, a gastroenterologist, and in my clinical service and my research, I'm working extremely focused and oriented towards the really small details in medicine, but this is completely different and much more important. So the topic I was given was dilemmas related to overuse of treatment, and provide some ideas how can we target this by educational means. And then, Nina, I'm sorry, I don't have the solutions yet, but I'm confident that we will develop our medical education further. I also could not resist to show a picture of this person on the right here as an illustration of something which is a major problem in Western medicine. This is President Donald Trump in his emergency room, and he received during a rather trivial and not severe SARS-CoV-2 infection a cocktail of drugs which are otherwise only used in severely ill patients: dexamethasone, remdesivir, and the Regeneron cocktail of antibodies. And this illustrates to a certain extent what has been the focus of a lot of work in clinical medicine the last years, which is summarized like doing more does not mean doing better. And also the slogan, less is more. So what is this all about? And I think it fits very well with the goal of SHE. First, this graph from the Kaiser Foundation. The numbers go up to January 2012. We can see a dramatic increase in total health expenditure. Of course, the graphs, I mean, this is nearly 10 years ago, and I can assure you that this has exploded even more. So the total amount of money used on health expenditure per capita in many countries are just exploding all the time. This is not sustainable. And what is also not sustainable is the cost of unnecessary services delivered in healthcare. So you can see from this, well, is it a cookie slide, cost in billion US data, a lot of resources being invested in unnecessary services, inefficiently delivered services, administrative cost, and excessive pricing. And of course, we can argue, is this less in this country? Well, probably not. This is out of proportion overuse and misuse of non-diagnostic testing. So some of the current paradigm, often many doctors, many students, many people in the general community think that if some medical care is good, then more care should be better, and that newer technology is always better than older methods. Also a misunderstanding that getting a medical test can't hurt. We should look into this. That's what Donald Trump often says. Prevention is about getting the right test at the right time, another misunderstanding. And I'm not going to go into details about cancer screenings and cardiac screenings, because that is a really difficult topic. But many people have argued that do these screening programs do any good, or maybe they don't do any good. So what to do instead? Prevention. by lifestyle choices and public health measures. Medical care needs to be the right test or treatment for the right patient at the right time. Almost all care has benefits and risks. We often, as doctor, only think of the benefits and we neglect the risks. So in a way, we think that, well, it can happen, but it will not happen with my patients. And in general terms, if a test or treatment has no known benefit, no risk is acceptable. So this has been the focus of a work which has been spread all over clinical medicine. The initiative came from the US, who really saw this as a major problem. They initiated the Choosing Wisely campaign, which has been run in the US for several years. We have a European counterpart of that as part of the European Federation for Internal Medicine, where I've been active for a couple of decades or so. And we have also introduced this to Norwegian internal medicine. This is Professor Antonio Vaz Carneiro, head of the Cochrane Foundation in Portugal. In Portugal, they have produced a lot of papers on the Choosing Wisely initiative and what to do, what not to do, what to avoid. And we do work with this as well within Norwegian internal medicine, as many other Norwegian specialties are working with: geriatrics, medicine, immunology, radiology, gynecology, etc. And this is the web page. This will have to be combined into our curriculum, and I just want to point to for me a tremendous inspiration in thinking about science, and that was the conference in 2019. A lot of people attended at the Georg Sverdrup's hus. Fortunately, it was before the COVID-19, so we could meet in the same room and experience and talk and discuss. And one of the keynote speaker there was Anthony Smith, so from University College of London. And I just want you to take a look at the lower two slides here, which are full of details. Students-wise, we really care about our students. We love our students. Sometimes we do not always agree with our students, but it is exactly the same topics and the same questions that our students raise to us that Anthony Smith referred to from University College of London. Do they feel they have a voice? Do they feel they listened to? Is their feedback acted upon? And why do we need that? Well, there are diverse student needs. Also, it's staff face workload issues is a problem, of course, at the clinical medicine part of our study. We have something like 350 teachers, a lot of opinions. We want to encourage, we want to encourage partnership rather than consumerism in higher education. So a student should never be looked upon like a student, and we need to empower students and gain more skills. What does this, how can this be met in our curriculum? Well, first, bullet point, realistic goal. If the clinicians do not cope with the less is more initiative, the Choosing Wisely initiative, how can we expect this from the students? I think that doing the right, picking the right choices or doing the right decisions is a really on top of our cognitive learning. We need to focus a long-term goal to heighten the students' and the clinicians' awareness on source validity, and that is the focus of all teaching these days from our barneskole, grundskole, etc. And we need to really take that into account also in our medical curriculum. We need to increase the curiosity. We need to raising the awareness on training and thinking evidence-based medicine, and we already have that. To some extent, we need to broaden it, and we are involved with an initiative in women's health addressing exactly evidence-based medicine. And my last point is that we have to accept less details in our learning objectives. The students are not consumers, they are students. And we shall, as Anthony Smith said, we shall educate them in how to think, not what to think. So thank you very much.